I'm Dr. Amelia Siders, and I am here again for April's blog topic of prevention. And the biggest thing that I'm going to focus on today is the issue of child sexual behaviors and prevention of future concerning behaviors as they get older, what's normal, what's abnormal for children with sexual behaviors with each other. And the issue and concern that sometimes I hear from parents that if their child is a victim of sexual abuse, does that mean that they are going to abuse other people when they get older? And that is a very understandable concern. But I can tell you that to start there is no guarantee that when something happens to you, that means that you're going to do that to somebody else. There are so many different factors that go into why adults perpetrate sexual abuse on children. There's not one thing that determines that, and that just because you have a history of sexual abuse in no way guarantees that you are going to do those things to other people. Probably the number one piece of prevention, and what we talk about a lot at the Children's Advocacy Center, is getting children in as early as possible for supports and counseling related to their own abuse, or it could be their own abuse and the parents might be noticing that they may be acting out and doing other sexual behaviors, either on themselves. They may demonstrate those things when they're at home or out in public, or there may be a report that they might have done something of a sexual nature with another child, their age or a little bit older, with them, and they may have initiated those behaviors. And that can really spell a very scary kind of alarm period for any parent that they want to try to get a handle on that and figure out what to do. So I want to give you all a resource to look at, because I could talk for 15 hours just on normal versus abnormal sexual behavior. There's a website that I want to refer people to that is the National Center on the Sexual Behavior of Youth. And it will be posted here. You guys will be able to see it. We'll also post it on our website for future information. But one of the key pieces in prevention of concerning sexual behaviors is first educating yourself on what a normal sexual behavior for that child's developmental level is versus an abnormal sexual behavior. And the website that I gave you has wonderful resources, not only for parents, but for treatment professionals, for community members, about all different types of topics related to sexual behavior issues with kids. And to give just a quick example of something like that, because we all are raised differently as far as what we understand about what's normal and abnormal related to sexual behaviors. But for example, a 4-year-old child who may be sticking their hands in their pants a lot, who may be showing some masturbatory behaviors, who also may be curious, and you may find them in the bathroom with another child looking at their private parts or asking about privates. That is completely normal developmental behavior for that age, and that would not be something that would be a red flag to us, that there's something that's happened to that child or that they are doing something wrong. Now, it is still important, as you've probably seen other videos that we've done and other information, to educate your child on appropriateness, about body space, about body safety, about approaching other children, and teaching them respectful boundaries, teaching them when kind of touching themselves, when places that's not appropriate, and when they need privacy, when it's okay to talk to other people about something they're worried about related to a sexual activity or they have questions. Those are all things that we've kind of addressed in other ways, or we will be addressing in the future. For some people, they may breathe a sigh of relief and recognize that that is not something, that behavior is within the normal developmental realm for that child. There's some pretty clear indicators when something is much more concerning for children, and especially when you see a drastic behavioral change. That's one of the things that is going to be a red flag that will make you want to look into that further. So child-on-child sexual abuse, when there is a behavior that is concerning, it's something that's crossed the line and it's not in the realm of developmental kind of appropriate behavior, is something that we see all the time at child advocacy centers. And sometimes that is an indicator that that child themselves have been abused, and they may be acting out those behaviors with other children. That is not an uncommon thing that happens. Many children, the only way they can make sense of sometimes the abuse that they experience is to act it out with others, so that the more that parents are aware and paying attention to their child and report those concerns to counselors and professionals, the more that we can get help for them, and we can really educate children and parents on how to move forward and help them deal with these behaviors. They are definitely behaviors that we can work on in counseling, and it's a combination of supports and education for parents, developing a safety plan, as well as working with the kids on appropriate boundaries, kind of what's safe and not safe as far as behaviors go for themselves and others, and that these things are completely treatable. If you want more information or more specific to your child, the next step to prevent future behaviors from developing is to reach out to counseling professionals who specialize in those areas in your community. People that specialize in working with trauma, people that specialize with working with children should be able to have those resources and supports available to you to be able to give you some more information. There are some great books and other resources that are available on the web, as well as at our local libraries that parents can access and utilize. And we will be posting some of those things on our website as well for you to look at to decide if there's something that you might find to be helpful. The last piece that I want to kind of address in a more general way too is safety planning. So if you do have a concern about your child acting out sexually in a way that isn't within the normal realm, consult with a counselor, get your child in treatment. And also, maybe they need to be forensically interviewed to make sure that nothing happened to them. But the other piece is just common sense safety planning. While you're waiting for maybe some of these services to kick in, make sure that your child is never unsupervised when they're with another child, or they could be alone in a room where something could then unfold or happen. So being able to protect your child and other children from those behaviors from developing, that's the key piece. And so being able to consult with somebody about safety planning for your child, and that doesn't mean shaming them or making them feel horrible about what they're doing. It's just about being proactive and supportive and saying, I have some concerns about the behaviors that you have right now, and so I'm going to do everything I can to make sure you're safe, and you can also help me make sure you're safe. So those are some things just kind of right off the bat that we can look at when we talk about prevention with kids related to child sexual behaviors. And I hope that you have found that helpful. And we'll make sure that we post some resources on our website for you to look at as well. Thank you so much.